But I also think that this is not so bad, I would say, because in those countries, for you to work as a doctor, as a medical doctor, you have to go to residency. Um, as opposed to here in Brazil, where you don't have to go to residency, you could just start working. In the US, you have to. It's an obligation. You can't work as a doctor if you don't go to residency. So I think that even if they don't have a lot of practice during medical school, that's not a huge problem because they will get to practice in residency. And I think that their residencies are amazing and they have really great programs. So I don't think they lose much by not being so active during medical school. In Italy, though, I believe I'm correct about this, but I would have to research a little bit more. But from what I remember that they told me, you can work right after completing your medical school training. However, you can't work with certain specialties. You can't, not certain specialties, with certain types of work. You can't, for example, be work with emergency, like more serious emergencies or things like that. But you can, for example, do primary care or occupational medicine. So you can do, there are, this I'm sure of, I'm just not sure of which types you can do, but you are allowed to do some things. There is probably a list of things that you can do. But right after you get out of medical school, you can work. But you just can't do complex things. For that, you need to go to residency. So basically, to sum up, I think that they don't get as harmed because of this, because they are basically obligated to go to residency afterwards. And in residency, you probably get to practice a lot. So it's not such a bad thing after all. You know what I mean?
I believe it must be something like the step three in the United States. You have to take the step three to work unsupervised. And this is a kind of difference we don't have in Brazil. Supervised and
Yeah,
unsupervised work. Once again, in Brazil, almost every work is unsupervised. And I'm going
exactly.
to justify why I found it funny when you said that you can't work at some areas like emergency unless you have a residency. And the reason I laughed at that is because here in Brazil, emergency and critical care are the most common areas for people who have just graduated to work. The
Yes,
residencies do
yes.
exist, but the emergency medicine residency is very recent. It has
Yeah.
like 10 years. The critical care one is older. But in some parts of Brazil, I'd say we see most of the people working with critical care and emergency medicine are brand new MDs, are people who have just graduated and haven't even started residency, for example.
Yes, that is so true. And I think it is insane. And I think it's more of something that you, as a doctor, as a medical doctor here in Brazil, should be aware of because people will offer you jobs. They will offer you those kinds of jobs where you will have no resources after, first of all. And you will be working with very critical patients in, for example, in a very small city, a very small town, where you don't have a lot of resources. They will offer you those kinds of jobs. But I think this is more of a good judgment that you, as a medical doctor, should have and not accept those things, even though they are allowed. You're not prohibited, to do those things. It's allowed here in Brazil. You are allowed to accept a job in emergency or in critical care. There is nothing that they ask of you. So I think it is very risky for you to accept a job as a recently graduated doctor, medical doctor, because you basically don't have that experience. But here in Brazil, the only thing that stops you from going and working on patients that are critical and in emergency, basically what stops you is you not accepting the job because the opportunities exist. They will offer you a job in a very small town in the countryside with no resources, um, and you will basically get a lot of emergencies because that's their only place that they have to go and be seen by a doctor. And I think that you, as a medical doctor who is recently graduated and who has recently graduated and have no experience, it is your job to not accept this opportunity, because even though sometimes they pay very well, and even though they are offering you this opportunity, and even though you are allowed, because I don't think there is any, something regulated, or there's not a regulation that you need to follow for you to accept those kinds of jobs. Even though you shouldn't accept it, you shouldn't accept it because it is very risky, and you could even get traumatized and never go back to work again. I know people who have accepted opportunities like this and who have faced very, very serious problems with patients and not having the resources, not having the experience, and they got traumatized and never went to work again. So even though you are allowed to do, which I think is a very insane situation, even though you are allowed, in my opinion, you shouldn't take those jobs. Talking about my own experience right now, I have just recently graduated. I have been offered very nice opportunities, and I have been offered not so nice opportunities in this aspect. And for example, I was offered a job in which there were only 2 doctors on call, and one of them is not required to be an emergency doctor. And because we do have the residency here in Brazil. And I didn't take that one because I was like, I really, at least I want to have someone who is comfortable with emergencies to be there with me, in a hospital. And I have been offered jobs where I have 5 other doctors, 6 counting me, and an emergency doctor. And that's the opportunity that I took because, I want to be safe. I really want to learn emergency and I want to be confident with emergencies, but I want to watch it first. I want to do it. Maybe I want to do a procedure or something like that supervised first, and then get confidence maybe after 1 year, 2 years. I don't know. It's very personal. And then I will be able to accept a job like that, or maybe not even. Maybe I would have to go to emergency medicine residency to do this. But what I'm saying is, if you're not confident, don't do it. But what is very hard is for people to have this kind of thinking. A lot of times people are just focused on the money, on the opportunity, on things like that, and they forget that these things are very, very complex and very complicated. And this is my opinion. But of course, we have different people who think in a different way. But this is the way I think.
I think this speaks a lot to perhaps all Brazilian doctors. I wouldn't say I was traumatized, but I would be lying if I said that my personal experience did not play a part in deciding to focus more on medical education and less on actual healthcare, on providing actual care to patients. It's undoubtedly much safer, much more comfortable. It has a tenth of the responsibility. So I wouldn't say I was traumatized, but I think you would be hard pressed to find a Brazilian physician that says they left university and went straight to work and were perfectly comfortable and remember these first days fondly. I
Yes.
very much doubt there is such a thing.
Yeah.
And that has to do with what you mentioned, that here in Brazil, we don't have to do a residency, contrary, for example, to the United States. And I was completely unaware of how things worked in Italy. But the residency in the United States, for example, surgical residencies are 5 years long. So you have almost a new med school to hone your craft, be it surgical or clinical, and gather a lot more experience.